It's important to recognize that everyone is impacted by disasters and stressful situations differently, but there are patterns that we tend to see in terms of the way that individuals respond. So initially, there's almost an anticipation. If we know or fear that something is coming, that can cause people to respond with anxiety. But it's also an opportunity for individuals to prepare. And then when that disaster actually hits, oftentimes there's initial worsening of anxiety as people are disoriented. Oftentimes after that, we see a period where there's almost a sense of cohesion or a response where people start to rally their resources, kind of a we can do this, or we can come together and manage this. The challenge becomes that when the nature of a disaster is more severe than what we anticipate, people can fall into kind of hopelessness, depression, withdrawal. And so that's a high risk period for individuals. What we tend to see with communities over time is that there is a period of kind of rebounding where people can return to their, baseline level of functioning. They can kind of regain what they had lost through the disaster. And sometimes we even see what's called post-traumatic growth, where by making it through a difficult period, we can develop a sense of resilience, like we've handled this and we're stronger because of it. And that's ideally where we want to get to. The times where we tend to see individuals having the most acute distress is when that disaster hits. But oftentimes people aren't reaching out for help at that point. And most people will recover after that initial shock settles. Where longer lasting issues or more concerning issues can set in that can cause people long-term difficulty is when they feel like they're overwhelmed. It's when that feeling that this will never end sets in. So the longer the trauma is present for, and the less people feel they have influence over it, those factors result in a higher risk for longer term mental health concerns.